I think the iboga in a sensory deprivation tank would be the ultimate.
Well, that might be a one to work up to. And prior to that, because like oftentimes people ask me the question like, okay, I'm ready to have an experience. Where do I start? So step number one is float, and just float by yourself. Because a lot of people haven't even floated yet and really looked at their stuff. Because interestingly enough, it starts to promote our own DMT-like experience. We see what's in the default mode network now comes online. We're able to look at more introspective analysis and see what was just behind the curtain that we didn't notice was there, and now that comes onto the stage. We can wrestle with that, we can be with that, see what comes up, make sure that we're okay with the unknown, that kind of sense of dissolving back into the void. And then you can start stacking therapies, like doing something in the tank. And so your more entry-level psychedelics would be like MDMA, DMT,
edible weed,
marijuana, as the next kind of entry point. And then beyond that, then you get into, and psilocybin I would put in that entry level point. And then beyond that, you get into the second level, and that's more like the peyote, wachuma, San Pedro, ayahuasca, iboga. And so it's nice to be able to know where people can start, how to progress them through. That's a lot of the psychedelic research that's happening now is the correct screening to know who the experience is good for, who it's not good for. People with a history of psychosis and mania, not good for. People currently on psychiatric medications, not good for. Because most of the medicines and psychiatric medications don't work well together, and there's an energetic clash, and you can have a real bad trip where you could have physiologically dangerous things happen. So when we know, we've got this whole arsenal to work with, and then it becomes alchemy, knowing which medicine to use at which person at which time, and in which sequence, which order. Like what are your target symptoms? If your target symptoms are anxiety associated with chronic pain, well, great. Then it might be something like iboga is helpful, because iboga is really helpful for pain, because it's associated with that opiate pathway. And also, let's prep with flotation and let's integrate with flotation, because flotation itself is also very good for pain. Just flotation by itself. You start stacking therapies, and I've seen clients, and I've had clients that have done a series of 7 to 10 floats, and all of a sudden now they're off of all their opiates before, with resolution of their underlying symptoms, whether it's PTSD, anxiety, insomnia. And then they do maintenance floats after that. So 2 to 3 a week for like 3 or 4 weeks, and then you do booster floats, like 1 a month. And some of the psychedelics are kind of similar. When you go through a big experience, you have a long period of integration, and then maybe you do a booster shot. Now, the whole psychedelic experience here in the States is under a renaissance. There's a lot of energy moving. There's a lot of clinical trials coming up in really reputable centers, like the Hopkins study with psilocybin. Massive. That really put psilocybin back on the map in the scientific community, because the study was so well designed and the outcomes were so amazing that you couldn't refute it. 94% of people who were psychedelically naive had one of the top 5 spiritual experiences that it ever had. And that experience lasted 14 months out with no side effects. You're like, holy cow, that's pretty amazing. MDMA-assisted psychotherapy. 83% success rate for curing chronic severe PTSD after only 2 to 3 sessions of MDMA-supported psychotherapy. So it's not just taking a drug and having your trip and all of a sudden now you come out the other side resolved. No, it's like actually working with a trauma-trained therapist in a really supportive, safe environment to work through that, because MDMA is so good at the de-armoring that happens when people are traumatized. And the data is just so iboga with addictions, and psilocybin even with addictions. There's just a recent pilot study that came out. 80% of people with chronic addiction to tobacco resolved after one-time use of psilocybin. Right? And so what's like the next second best thing that the allopathic medical community has for that? What's like Nicorette gum at like 8% success rate. So you just went from 8% to 80%. And oh, by the way, you just had a transformative mystical experience.